This step-by-step video will review procedures for donning and doffing a cervical collar. A cervical collar provides support and restricts movement in an individual's neck while bones and tissues heal. One reason you may need to take off your cervical collar is to clean the pads. This is recommended at least once each day and may be done best prior to showering. Please remember to adhere to these cervical collar precautions. No pushing, pulling, or lifting over 5 pounds, no forcing of bowel movements or holding breath during activities, and no movement of head or neck without cervical collar. Client lying down. Doffing the cervical collar. Step 1. Removing the back panel. Using one hand to stabilize the front panel and the other hand to manipulate the straps, remove one Velcro strap, then remove the other one. Push down on the back panel with the other hand and slide it towards you until it is no longer under the client's neck. Step 2. Removing the front panel. Pull front panel away from the client's neck. Donning the cervical collar. Step 1. Putting on the front panel. Open the sides of the front panel outward. Make sure the top of the collar sits under your chin and supports the jawbone. The client's chin should not slip down into the collar. Hold firmly with one hand. Push the sides of the front panel around the client's neck. Step 2. Putting on the back panel. Place the back panel on the back of the client's neck by sliding it in place from the side. The end of each strap should come to the same position on each side. The straps should be centered between the ear and the top of the shoulder. Step 3. Attaching the front and back panel together. While holding the front panel with one hand, attach both sides of the back panel to the front with the Velcro straps. Alternatively, tighten the straps, one at a time, until the collar is in place symmetrically. Client seated facing mirror. Independently doffing the cervical collar. Step 1. Setup. Client should sit down in a chair facing a mirror with a clean, even surface directly in front of them. Step 2. Removing the front and back panel together. Unfasten one side of the collar straps while stabilizing front panel with other hand. With the other strap still attached, carefully remove both panels together. Independently donning the cervical collar. Step 1. Setup. Attach front and back panels using Velcro on your non-dominant handed side of the cervical collar. The straps on one side of the cervical collar panels are attached front and back. Step 2. Putting on the front panel. Bring the front panel of the collar to your neck and place it under your chin. Make sure to keep your neck in neutral position. Step 3. Putting on the back panel. While holding the front panel in place, use dominant hand to bring the back panel around your neck and secure the strap on the other side of the collar. Alternatively, tighten the straps one at a time until collar is in place symmetrically.